Thank you very much. Hello, everybody. Good afternoon, everybody. I'm Shend Kryeziu, a medical doctor from Kosovo. It's an honor for me to be presenting in front of you the challenges of cancer care in war-torn countries. This job is a collaboration between a lot of authors, including me as the first author and the presenter, then Patricia Tai, Omar Al-Kaisi, Ayov Jones, Laurencia Arina, Kelvin Wong, Edward Yu, Osama Sawed, and Rashmi Kaul. As I said, this work is an international collaboration of researchers from Kosovo, Jordan, and Canada, irrespective of racial, religious, cultural background. I am a recently graduated medical doctor from Kosovo with a strong interest in internal medicine, especially cardiology, as well as surgery and cancer research. I am recently or currently collaborating with colleagues as part of a cancer research team under the mentorship of Professor Patricia Tai, to whom I am very thankful for this opportunity. We declare no conflict of interest. Introduction. As everybody can tell, war disrupts healthcare systems, especially the cancer care system, by affecting three levels. First, destabilizing the infrastructure, then draining financial resources, and the third one is displacing healthcare personnel. Also, hospitals and clinics may become unsafe or inaccessible due to bombardment, military occupation, or evacuation of the staff. There's also interruptions in core treatment, including the essential medical services such as chemotherapy, radiotherapy, surgery, and follow-up care, which are frequently disrupted due to systemic breakdowns. There's also supply chain failures, which compromise the availability of critical medication, also blood products and stem cell donations. And in the end, there is also logistical barriers which significantly hinder the safe transport of critical medical resources from external regions. Scope and approach of the study. We did a comprehensive literature review and focused on publication from the past 5 years. Researchers from Ireland, Jordan, Lebanon, and Kosovo all contributed by analyzing their first-hand experiences and data regarding cancer service delivery in conflict settings. We came up with some results. We focused on presenting two war-torn countries, and the impact of war in their in their healthcare system. First one is the impact of the Gaza war on pediatric cancer care in Jordan. The war on Gaza since 2024 forced Jordan to receive more than 23,000 children for treatment at the King Hussein Cancer Center, which is the only center in Jordan for treating cancer patients. The children there are received at intermittent intervals, which increases the consumption of medical equipment, stresses the medical staff, and also increases the pressure on the center. On the other hand, we have Kosovo, which is a post-conflict country. Cancer care in Kosovo faces significant challenges due to the lingering effect of war, economic instability, and damaged healthcare infrastructure. Despite declaring independence from Serbia in 2008, Kosovo is still in a rebuilding phase, with many of its systems, including the healthcare system, grappling with the aftermath of war. The most impact of the war can be seen in the lack of adequate medical facilities, in the limited access to modern treatment options, and the shortage of specialized medical staff. Fortunately, in recent years, the first and the third one are not considered any more challenges, but Kosovo needs more focus in improving the limited access to modern treatment options. And that is, both regions highlight how conflict severely disrupts cancer treatment. whether by overloading healthcare centers, as we see in the Gaza case, or by undermining the foundations of an already fragile medical system, as we can see in the Kosovo case. And in the other hand, we present some of the most common disruption in the conflict zone, healthcare disruption in the conflict zones, which are vaccination interruptions, routine vaccines such as those we get after post-splenectomy may be delayed or missed due to staff and vaccine shortages. There's also supply chains and sterilization breakdown. So essential supplies such as masks, gloves can't be restocked due to damaged transport or security issues. There is also a power outages which compromise sterilization of surgical tools and also threaten the safety of the procedure. And the attacks or the explosion, bombardment of on infrastructure and health facilities severely disrupt the operations. There is disruptions in diagnostic and follow-up service. Diagnostic services such as imaging or labs fail when equipment is damaged or staff is unavailable. And also the follow-up appointments are delayed or canceled due to patients' displacement of clinical unavailability. And we all know that follow-up appointments are very critical for monitoring disease progression or response to the therapy. And communication and patient records breakdown, infrastructure attacks result in communication blackouts and loss of medical records. Continuity of care suffers severely when patients and providers lose access to records or contact. And also there are challenges in the therapy. Cancer treatment regimens are often halted or altered in conflict zones. Advanced therapies such as precision medicine, pharmaceuticals, and cellular therapies become unfeasible due to unstable infrastructure and international coordination breakdown. And in conclusion, we can say that cancer treatment demands stability, coordination, and resource access. Which conditions are rarely upheld in active conflict. While international humanitarian efforts can offer temporary relief, sustained access to safe and effective cancer care is only feasible in times of peace. Collaboration across governments, non-governmental organizations, and healthcare providers and global institutions as well is essential to protect and restore cancer services. And in the end, the preservation and restoration of cancer care during crisis is not merely medical, it's a humanitarian duty after all, rooted in equity, dignity, and the right to health. So in conclusion, we can say that the only solution is bringing peace and maintaining that peace. So in the end, I want to thank all the bodies who collaborate in this research and help me do the research. Especially, I'm very thankful to my mentor, Professor Patricia. And of course, thank you for listening. If you have any questions, you are free to ask. Feel free to ask. Thank you.